The day a baby is born or shortly thereafter, their parents are given a schedule for office visits and vaccinations. As a parent, it's your responsibility to make sure your child attends all their visits and gets the proper vaccinations to stay safe and healthy. Once that schedule is complete, then what? We don't do much in terms of prevention, do we? We simply wait for an acute or chronic illness to present, and then we take action. This is the opposite of what we should be doing. Prevention is key to avoiding chronic illness and disease. The more empowered we are about your personal health needs, the healthier we will be. That is why I recommend following a preventative lab schedule to improve your quality of life, as opposed to a lab schedule that is based around disease or illness. A preventative schedule will help you take proactive steps in your health care and your family's health care for years to come. You can get these labs through your provider, or if you are near our clinic, we can help you get you those as well. The lab schedule I recommend for preventative health includes labs every 6 months. We get our teeth brushed from the dentist every 6 months. Why not check our blood? I recommend a principal lab panel. You want to make sure you're adding reverse T3 if that isn't already included. You also need to add an ANA and a PSA for male. This typically costs around $250. This is the lab we run through our office. If you cannot find a provider by you, we are happy to run that for you. If you are not using the principal lab, the markers in this lab is about 80 different biomarkers. It would cost you about $1,800 if you did not have insurance and you ran it through your insurance. So we will provide a list at the end with the lab and all the markers. We just want you to know that if you do run it through your insurance and your insurance doesn't cover it, it's going to be high. So if you can find somebody who runs this lab panel and has an agreed upon cost with LabCorp, that's definitely the way to go. Every 9 to 12 months, you will want to do another set of preventative screenings. I suggest functional urine, functional stool, functional saliva, functional hormone, and microcellular nutrient. These screenings will show you things like how your body responds to specific stressors, what your mood and outlook on life is, and what your body needs more of to protect itself from developing disease. Together, these several tests will run about $1,500. There are several places you can get them done, and there will be links to these in the notes section as well. Every 24 months, especially if there's any cancer history in your family, I recommend an IV gene screening. This is a cancer preventative screening. It is a simple blood test that your primary care provider can help with, or your functional medicine provider. There is a link in the notes section to IV gene screening with details. They test for early signs of breast, liver, colon, kidney, and lung cancer. I also recommend getting a 23andMe at some point throughout your life. That is a lab that you can get at 23andme.com. Again, a link will be in the resource section. The genetic information you can learn from a health report is invaluable. You can learn things about your health that you never knew before that could lead you down to the path of healing or understand why there has been a path of disease. There will be a link in the notes section. The following screenings are good screenings to make sure you ask your primary care doctor about. Thermography, which is a cancer preventative screening. A mammogram, per your doctor's recommendation. If you have dense breast tissue, you're going to request a breast MRI. Protein electrophoresis, which is a lymphoma preventative screening, and a lung cancer screening test. Prevention is the best way to fight off chronic disease, illness, and poor health. Very similar to the skin. The best way to prevent looking older is to wear your sunscreen every day. You have the knowledge and information you need to take your health into your own hands and make a change for the better.